we start and then we so we do move to this presentation and so let us try one more time. So there is some problem with the PowerPoint application. It takes time. No, we don't mean this. Okay. So it doesn't work. Let us try to do something with the next presentation. So which was okay, which was called just English, and which is actually about patient-centered approach, right?
Yes, ma'am.
So we'll wait for the slides to open, and so who's going to speak about this?
Mohammad Abdul Rafiq, Sheikh Ume Armin, Shamata Prabhakar and Rajkumar. Rajkumar is not here, ma'am.
Rajkumar is not here.
No, ma'am.
He's here, ma'am.
Why?
I am here, ma'am.
Ma'am, he is here. He is here.
Okay, I see. Well, and we'll try to. Mhm. So, do you see the application?
Yes, ma'am.
Mhm. Okay. Well, so who will start speaking? Start, please. Samhita?
Yes, ma'am.
Mhm.
Ma'am, actually, when we talk about patient-centered approach, it is basically a more of a approach that is beneficial for both the doctor and for the patient. Ma'am, when suppose a patient is coming to us, it's our duty that the patient should be crystal clear with the doctor, and the doctor should be crystal clear with the patient. There should be no hidden facts and other things between the patient and the doctor. And this basically compromises of 8 things, that is 6 things basically. That is exploring the disease. Now suppose a patient come, we should be very clear about what symptoms he is having, from how long he is having, is there any other medical history associated with him, and we need to do the proper test. And then the second thing is we should understand the patient's personal life, that how this disease is gonna infect him in his personal area of his personal arena of his life or her life. And uh, if the given treatment plan is something that he can accommodate in his personal life, because at the end of the day he have work life too which has to be taken care of. So that should be given in a detailed descriptive format with the patient. And then we need to find the common ground with the patient. That is how uh, how far the patient will go for a treatment, how far he will take to recover from a given symptom, and how long it will take. So, ma'am, basically, this is patient-centered approach. According to me, it is quite necessary in this field, because if the patient and a doctor are not in a good communication term, then number one, the treatment will take long, and ma'am, uh, apart from it, ma'am, all the uncertainties and every other aspect that should be given to the patient, that these are the uncertainties in the treatment, or these are the uncertainties in the following plan. If it is not given provided to the patient, then it can be, I won't say dangerous, but it will be difficult for him to recover. Also, ma'am, when a patient is there, we need to make sure that his family, there should be one person who should know about his complete details, his complete test, and apart from it, his follow-up routines, his exercise, his diet, everything should be clear to the patient as well as to the family. Now, Rafi will continue. Thank you.
Shall I move to which slide?
Next slide, ma'am.
Next slide, ma'am.
This one?
Next, ma'am.
Next, ma'am.
Next.
Next. Yes,
Rajkumar.
ma'am.
This one, right?
Yes, ma'am.
Yes, ma'am.
Rajkumar, are you here?
Who is speaking?
Yes, ma'am. Yes, ma'am. Good morning, ma'am. Myself, Rajkumar. I'm going to explain about the differences between doctor-centered approach and the patient-centered approach. Basically, doctor-centered approach is completely independent to the patient. Whereas patient-centered is they will know about the disease or illness what they are actually doing. And a doctor-centered approach is totally a paternalistic approach. Like the paternalistic approach means the doctor plays a dominant role in that approach. They only take the all decisions. While in patient-centered approach, the person receiving healthcare with dignity and respect, involving them in all the decision about their health. So that's why it's called as It's also called as person-centered approach, ma'am. Uh, and doctor doctor and doctors doctors in the approach ask leading questions, ma'am. While as patient-centered approach is like holistic approach. Ma'am. Holistic approach means to provide support that looks at the whole person, not just their mental health needs. Ma'am. The patient-centered approach should provide uh, and also consider their physical, emotional, social, and spiritual well-being. Uh, in doctor-centered approach, patient health is entirely in the doctor's hand. Patient-centered approach is like they are involving the patients for the research. Uh, the next topic will be done by Rafi.
Yes, ma'am. Can you please show turn next slide? Turn to next slide.
So I'm trying to move the next slide. Mhm. Mhm. Okay.
Yes, ma'am. I would like to say about the barriers and facilitators of the patient-centered care approach, ma'am. Ma'am, first of all, I would like to say about barriers, ma'am. Ma'am, there are many barriers like staffing constraints, ma'am, and reduced levels of staff experience, ma'am. Like, ma'am, if uh, if, uh, uh, if the staff is not well experienced, ma'am, or they or there are short staff, ma'am, it may create problem and difficulties which may increase the time period for that patient and doctor, ma'am. Then the another barrier is high staff workloads and even time pressures, ma'am. Ma'am, if we take example about the nurses, ma'am, the nurses have to take a fair bit of the work, ma'am, like discharging the patients, ma'am, then the clerical issues, ma'am, then the nursing. Apart from apart from nursing duties, they also have other duties, ma'am. So, in case many patients show up at a time, ma'am, it may seem impossible to handle them at a time, ma'am. Then the next barrier is physical resource and environment constraints, ma'am. Ma'am, even simple things like a comfortable chair and availability of beds add up to the physical resources, ma'am. Like if there is shortage of beds and all, ma'am, this may create difficulties, ma'am. And the next barrier is unsupportive staff attitudes, ma'am. Ma'am, we see many times that some doctors and nurses tend to get quite judgmental about who they have to give their compassion to, ma'am. Like who deserves it and who doesn't, ma'am. So there is also some perceptions about the nurses, ma'am. Like they ask patients not to visit after. When patients approach, they say these are not the visiting hours and all, ma'am. So now I would like to say the facilitators of the patient-centered care approach, ma'am. The first is the leadership focus, ma'am, or the patient-centered care, ma'am. Ma'am, like it is like asking the keeping up to the patient, ma'am, telling them what their plan is and what you expect from them in that delivery of care, ma'am. So then they know that's the expectation of care and they have meant to give, ma'am. Then there is a staff satisfaction and positive staff relations, ma'am. Ma'am, I think it's just the friendliness of the team, ma'am, and friendliness of the team which keep the staff, staff and the patients together, ma'am. Ma'am, here people feel they are valued in the team, ma'am, and valued in the team, ma'am. Then there are formal structures and the processes, ma'am. Ma'am, in this, ma'am, the doctors and the staff have to take updates from the progress of the patients, ma'am, even after the treatment, ma'am, which may build up good relationships, ma'am. Then one of the good facilitator is staff cultural diversity, ma'am. Ma'am, we know that there is people from many different backgrounds, ma'am, and I think that patient feel more comfortable, ma'am, to see that there is a range of peoples, ma'am. Like, ma'am, here we have got a high ethnicity of population, ma'am. So, ma'am, the patients feel they are welcome, ma'am, when the staff speaks the same language as the patient, ma'am. next is the health professional values, ma'am, and the role and the expectations, ma'am. Ma'am, the health professional has to take care of the patients, ma'am, because the patient is under their care, ma'am. Ma'am, to be a professional means that you have the patients at the center of your care, ma'am. Ma'am, now I would like to say about the benefits of the patient-centered care, ma'am. Ma'am, in this, ma'am, uh, the patient and the staff feel more physical and physical comfort, ma'am. The patient will get more emotional support, ma'am. Then there is much involvement of the patient, ma'am. So we get a much improved quality of the patient satisfaction and the services which are offered by the those facilities, ma'am. Ma'am, also there are enhanced productivity amongst the practices staff, ma'am, and it also reduces the staff. It reduces the overall pressure, ma'am, on the patient as well, ma'am, on the healthcare service provider, ma'am. So it reduces the overall cost of care. It also reduces the overall cost of care, ma'am, and encourages the patient to live a much more healthy lifestyle, ma'am, and they know how to take care of themselves, ma'am. That's all, ma'am. Now Samita will sorry, Ayman will continue, ma'am.
Yes, ma'am. Good morning, ma'am. Myself, Shekhar Ayman. Ma'am, I'd like to summarize the whole presentation. So, ma'am, can you please move to first slide?
This one?
Yes, ma'am.
Mhm.
Ma'am, basically, from the beginning, ma'am, this person-centered approach concept, it involves a partnership between the healthcare professional or a doctor and the patient and their relatives, ma'am, with the starting point where the medical history of the patient is taken. So, ma'am, there are some values like the mission is to value and align the patients with the patient goals, ma'am. The care and collaborative coordination, and ma'am, it should be accessible, and physical comfort and emotional well-being are the top priorities, ma'am, and some of these are there, ma'am. I'd like to, ma'am, can you move to the third slide?
Which one?
Ma'am, yes, ma'am, the same.
Mhm.
Ma'am, basically, patient-centered care, they actively gives you and your family the part in decision-making process when planning care and treatment, ma'am. Ma'am, patient-centered care is about respecting individuals' preferences and diversity. Ma'am, it involves recognizing your needs and respect your right to make health decision and choices, ma'am. And ma'am, this also include the right to comment, to ask the question and to make the complaints about your health. Ma'am, it is also known as person-centered care, ma'am. Ma'am, it has basic 7 core values that are individuality, independence, privacy, partnership, choice, dignity.
I'm sorry to interrupt you.
responsibility.
Sorry, but we have already listened to this information. Why
Yes,
do
ma'am.
we need to listen it for the second time when you are summarizing the same ideas? Does it make any
Yes, ma'am.
sense? I think
No,
I think we can stop now. Okay. So
ma'am, actually, we all were in synchronized manner, we all four, but I got late while joining the class, ma'am.
mhm.
So,
I see that you know this information and you can present it in a perfect way. So,
yes, ma'am.
so unfortunately, we are limited of time. That is why we need to
Okay,
stop
ma'am.
with this very presentation. It takes just a lot of time to speak about this. So,
Okay, ma'am.
thank you so much. Are there any other students from this group who would like to say something? Or did everyone have a chance to speak?
Everyone spoke, ma'am.
Okay. So I would like the other students to say some words about this presentation and using the criteria we were speaking about at the beginning of our class. So what do you think and how can you evaluate this very presentation? So please. the students from the other subgroups? No reply.
Yes, ma'am. The PPT is good, ma'am. They explained also. They could have reduced few points, ma'am, but it's enough and adequate only, ma'am. It's good.
Mhm. Can you give any recommendations to the speakers? Recommendations. No recommendations. So
We could have added the references where we from where we made this PPT. We haven't added references.
okay, and I would recommend the speakers of this presentation just to find some more visual aids, some illustrations, just to make it easier for the speakers to understand what, to make it easier for the audience to understand what the speakers are speaking about. I mean that sometimes, so the information was, there was too much information, and so I didn't just, you didn't give me the sign to move to the slides, and that is why I just sometimes feel a bit of lost in your presentation. So that is why just maybe you should have shortened the information and make it more concise, just to make it easier to understand. Okay. But all the facts, all the information was great, and it's very serious, just work that you've done. Well, and so let us have a look if we can see, if we can.
Share the older PPT, ma'am, because two of my subgroup mates are yet to talk, ma'am, and they want points. So if it is possible to open, please open.
So I'm trying to do this. Well,
Yes,
let me see. So let's try to open it one more time. Here it is. Well, well. So where did we stop?
Ma'am, yes, ma'am.
Yes, ma'am.
Please.
Yes, ma'am. Should I continue, ma'am? Can you hear me, ma'am?
Yes, yes.
Basically, the doctor should build a good relationship with the patient, which makes the patient to open up freely. A doctor should give him support, a full support, uh, by which the patient can openly tell his mental illness and also his physical illness. A doctor must encourage his patient and encourage him to tell everything truly and what he basically feels, ma'am. We'll have to accept whatever he says,
And we should not judge his feelings, ma'am. When he open up and if he tells openly about his feelings, we shouldn't judge. Being a doctor, we shouldn't judge them. And while doing examinations like physical examination, we'll have to ask him permission. For example, if we are going to examine his hand or elbow, we'll have to ask him permission. Let me examine here or there. We'll have to ask him permission, ma'am. Basically, we'll have to talk to him freely. We'll also should talk to him freely. That makes him talk to us very freely, ma'am. And he opens up very clearly and he'll be free with us, ma'am. And the next slides will be continued by Divya Sri, ma'am.
Yes, ma'am. Explaining and planning. Initiate, summarize to date, determine patient feelings, ideas, function and expectations, set the agenda, ma'am, and assess patient starting point, ask for patient's prior knowledge early, discover extent of patient wish for information, ma'am. And next one, chunk and check, give information small chunks and check for understanding, use patient's response as a guide on how to proceed, and ask patient what other information would be helpful, example like caution, predictor outcome, etc, ma'am. And give explanation at appropriate times, avoid giving information or reassurance prematurely, avoid merely giving advice. And organize explanation, divide into discrete sections, develop logical sequence, ma'am. And next one, use explicit categorization or a signposting. There are three things, important things that I would like to discuss. First, I want to tell you what I think is wrong. Second, what tests we should do. And third, what the treatment might be. First, repeat information and summarize. Next one is language. Use concise, easily understood statement. Avoid or explain jargon. Use visual methods of conveying information. Example like diagrams, models, written information, and instruction. And next one, check patient's understanding of information given or plan made. Next, relate explanation to patient's illness framework, to previously elected feelings, ideas like functions and expectation. Provide opportunities and encouragement for a patient to contribute, to ask questions, seek clarification or express doubts, respond appropriately, and acknowledge patient success and praise appropriately. Small changes are often the foundation for larger ones. They should be recognized. Next, pick up and respond to verbal and non-verbal cues. Example, information overload, distress, need to contribute information or ask questions, and elicit patients' beliefs, reactions, and feelings about information given or decisions termed used, and knowledge and address where necessary, and share own thinking, ideas, thought processes, and dilemmas. There are two possibilities here which might explain your symptoms, either an ulcer or gallstones, and involve the patient, offer suggestions and choices rather than directives, encourages sharing of patients' ideas and suggestions. Last one, explore management options, include information about risk and benefits. And next topic is closing the session. Before closing the session, it is essential to check patient understanding, and this can be achieved by feedback questions such as, can you remember what is this medication is for, or how long should you take this medication, and ask the patient about any doubts. And final one, before final closure and if time permits, summarize the main point in logical order. That's all.
Okay, so any comments on the presentation? from the other students? What can you say?
The presentation was good. It was to the point, concise, but I think they could have added more pictures.
Okay.
Explanation was really good.
Yes.
Everyone explained properly.
Okay, great. So thank you so much. And so that was about Calgary, Cambridge method. And I would like just to ask some question about this. So this method is called Calgary Cambridge. Why does it have such a name? Why is it called Calgary Cambridge? Why Calgary is involved here? Why Cambridge is involved? So the students who were speaking about this, can you answer this question?
Yes, ma'am.
Yes, please. Why is it called Calgary Cambridge method?
Ma'am, the Calgary Cambridge method provides a practical integrated method of teaching both the process of communication, ma'am.
I see, but I'm speaking about the name. Why is it called? Why does it have such a name? How is it connected to Cambridge? Okay. So logically thinking, I think it's like the authors of this method, the people who developed the method. So maybe they are somehow connected with Cambridge. So this is the name of the place where the university is located. So I think like this. Okay. Well, and so we have some time, just wow. Well, so do you see the presentation? My presentation?
No, ma'am.
No.
No, ma'am.
No, ma'am.
Okay. So we start.
Yes, ma'am.
Okay. Okay, thank you so much for just giving a great piece of information. It was very, just a lot of facts that I didn't know that, and it was very interesting for me. And so we should move on. So we are working, we are going to speak about working in general practice. And so we are going to speak about jobs that are involved in general practice. And if we look at the pictures which are given here on this slide, can you predict what each person's job involves? So what are they doing, and what are their responsibilities?
Ma'am, A1 is receptionist, B is doctor,
And
C
third
is
is
pediatrics.
C may be pharmacist, ma'am, or D is nurse.
yes, ma'am.
Okay. Okay.
D can be gynecologist also.
It's nurse.
Yes.
Treating old patients, ma'am. Geriatrician.
D, the one who's holding the baby.
Okay, so let us have a look at, so you were right. So receptionist, B picture is about health visitor. So a person who visits the patients who can't go to the hospital, to the clinic. And picture C, this is general practitioner. So the job which the doctor which deal with the patients at the very first stage, and midwife is picture D. As you see, they are pediatricians. They deal with newborn children, babies. Yes, and so in the next picture, the same question: what kind of jobs are there? Picture E.
Can be
Paramedic
porter
maybe.
or any.
F may be administrator or
It
G
may
may
be
be
hospital,
pediatric.
hospital administration, or the one who looks after.
G may be
Or
pediatrician.
the medical
Pediatrician, ma'am. G is
Mother.
pediatrician.
G can be pediatric.
Pediatric.
Pediatric. G.
Yes,
Okay.
ma'am.
Yes. So let's have a look. So this is district nurse because she's moving around the district, around the region to deal with the patients. So there is practice manager who organizes the process of treatment. And practice nurse in the last pictures you see. Well, unfortunately, we are. So unfortunately.